My name is Jonathan Coulls-Lartigue. I'm a cardiothoracic surgeon here at the Montreal General Hospital. I focus on diseases of the chest predominantly, and I have a particular interest in sarcomas and tumors of the mediastinum. Here at the Montreal General Hospital, we have an excellent multidisciplinary team led predominantly by the orthopedic surgeons here, given that most of these tumors involve the bone. But as I said, thoracic surgeons play an extremely important role, and this is a rapidly evolving field. So the management of sarcomas typically, like I said, centers on surgery, but also involves new chemotherapies, radiation therapy. And here at the Montreal General Hospital, we have sort of an integrative program whereby we're able to look at patient tumors, grow them in the lab, and potentially tailor our treatments. So that's a new and exciting field and something that's rapidly developing here, and something I'm happy to be a part of. The treatment for sarcoma is variable and multidisciplinary. Surgery remains probably the mainstay of treatment, so taking the lesion out. But like I said, it's a multidisciplinary approach, and sometimes it can involve chemotherapy, and often it'll involve radiation therapy. And those are given in particular orders depending on the way that patients present with their disease. So the treatments for sarcoma are variable. They depend on where the sarcoma is. They depend on the stage of the sarcoma or how advanced the tumor is. Is it just in one place or is it spread to other parts of the body? But generally, surgery remains sort of the mainstay of treatment. And in addition to surgery, some patients are given chemotherapy and some patients are given radiation therapy. There's some new novel therapeutic options that are coming out, so-called precision medicine, where medications will be based on genetic changes underlying the tumor biology. And some of these new drugs have shown tremendous promise in the treatment of sarcomas. But for the most part, surgery remains sort of one of the central treatments for these cancers. So I think what makes McGill, special in the treatment of sarcomas is the very multidisciplinary nature in which we approach each and every patient that comes in. We really treat everyone like an individual. Every cancer is different and every patient is different, and we take that into account when we're treating them. We have some novel programs. Sarcomas are rare, and so it can be difficult to apply knowledge to something that maybe not everyone has a lot of experience with. In one respect, we concentrate a lot of our experience here by being a referral center for these cancers and seeing a lot of them. But there's some new research that sort of underlies the treatment of these diseases that's new. We have a so-called living biobank, meaning that we will take tissue from patients, grow it in the lab, and if successful, we essentially have what we call patient avatars. This is extremely new, but it's also extremely exciting and something that I really haven't seen anywhere else.